Hello, my name is Marisol Meyer.
And I'm Siwan Louder. We are doctoral students at the University of Miami studying counseling psychology. We are members of the Coursera research team. While derived from the Spanish word meaning to grow, Coursera also stands for challenging racism and empowering communities through ethnocultural research in our team. Aligned with our mission, our team realized the heightened demand that the coronavirus pandemic has placed on healthcare professionals. To gain a better understanding of the totality of the impact on healthcare professionals, we conducted a survey study with two aims. Aim number one, to collect quantitative data on stressors, worries, support, and general health issues experienced by healthcare professionals, a broad term that we defined as including physicians, nurses, biomedical scientists, researchers, mental health clinicians, and all other allied health professionals. And aim number two, to analyze data in order to gain insight as to how institutions can establish structural plans to support healthcare professionals in anticipation of future global health crises and to provide recommendations based on these insights.
In this video, we'll explore our study a little bit. We'll talk about some of the key findings, as well as some key recommendations for professionals, organizations, and policymakers. 174 self-identified healthcare professionals filled out our survey. If you were one of them, thanks. We really appreciate it. The majority of our sample was white, female, born in the United States, and in the early stages of their career, meaning they've been working for 1 to 10 years. We're now going to go ahead and dive into some of the really important things we found in this study. Since the beginning of the pandemic, most professionals have not been able to enjoy normal day-to-day activities. They've lost sleep over worry. They feel constantly under strain and have been feeling unhappy or depressed since the onset of the pandemic. A majority of respondents to the survey are really worried about COVID-19 in general. Almost 95% are worried. More specifically, they're worried about the consequences a COVID-19 infection might have on their health and the difficulty of treating COVID-19. A majority of respondents to the survey feel it's really important to have psychological support regarding their concerns and are restricting social contacts because of their dangerous work environment.
Healthcare professionals who have been in the field less time have been losing confidence in themselves compared to healthcare professionals with more experience. Further, compared to their less worried peers, healthcare professionals with a higher degree of worry suffer from more adverse psychosocial outcomes, such as losing sleep, feeling constantly under strain, feeling like they can never overcome their difficulties, and feeling unhappy or depressed. Next, not hearing sufficient information about COVID-19 preventative measures specifically was associated with poorer mood and losing sleep over worry.
This study also investigated the potential psychological impacts of working directly with COVID-19 patients across healthcare professions. For MDs and DOs, working directly with COVID-19 patients was related to fears and concerns about being infected, feeling useful, feeling happy, being able to sleep, and feeling constantly under strain. As for allied health professionals working with COVID-19 patients directly, they were more likely to be worried about being infected, hearing sufficient information about COVID-19 from their workplace, and the likelihood of having to avoid duties in an emergency situation. Mental health professionals working with COVID-19 patients were more likely to feel concerns that their department is well prepared for a pandemic. For the last section of our video, we'll review some key recommendations from our lab based on the data we collected. These will be broken down at the individual, organizational, and policy level.
At the individual level, there are some steps that healthcare professionals can take to mitigate some of these adverse health outcomes. For one, professionals that are experiencing sleep difficulties due to worry might benefit from developing a sleep hygiene routine. Practices include ensuring the bedroom is only used for sleeping or intimate activity, avoiding screens 2 to 3 hours before bed, and avoiding stimulants such as caffeine or alcohol before bed. For professionals experiencing depressed mood or constant strain, engaging in self-care activities may be helpful. For high stress moments, journaling about the impact of stress on your emotions. Deep breathing, breathing in for 5 seconds, holding your breath for 5 seconds, and exhaling for 5 seconds. Repeat this as many times as you need. Next, engaging in progressive muscle relaxation may be helpful for some. Starting with your head, tense all the muscles you can in your face for a few seconds. Then relax. Repeat this with all the muscles in your body, moving down your body from the face to the neck, all the way down to your toes. For longer-term self-care solutions, seek individual counseling or therapy. It's also important to adopt self-soothing practices such as meditation or Tai Chi. Overall, it's most important to choose the self-care activities that work for you.
Organizations employing healthcare professionals might consider the following recommendations. Provide stress management workshops. Provide a culture of caring by ensuring professionals feel able to voice concerns about their mental health without fear of punitive repercussions. This might include the creation of an on-site support group, the implementation of policies that allow for mental health days, which might operate similarly to sick days, in which overly stressed employees are granted time to engage in self-care. Provide employees with the opportunity to provide feedback about their workplace, with the ability to do so anonymously. Make sure people are not doing multiple shifts if you're able. Improve the patient to provider ratio. Filter information to employees to avoid information overload, but make sure that this filtering doesn't censor information or degrade the quality of the information that the employees have access to. Organizations employing individuals impacted by the pandemic should continue to provide clear and concise information to their employees about all aspects of the pandemic and its impact. Organizations might choose to allow employees to opt into a newsletter containing a lot of this most up-to-date data and news. Finally, organizations can ensure adequate resources and material are immediately available. This should include technology to provide telecare, maybe through tablets or other devices, PPE, COVID testing, and on-site counseling.
Policymakers can best support healthcare professionals by increasing funding to support mental health care initiatives for providers, eliminating additional sources of stress that may be contributing to providers' overall psychological burden, such as financial stressors caused by unpaid student loans. Next, increasing access to all healthcare needs for providers by ensuring insurance companies provide more ongoing and long-term mental health care, and ensuring adequate healthcare is accessible both geographically and financially to prevent overwhelming individual organizations. By far, the biggest limitation of our study is our sample size of 174 participants. According to the CDC, there are 18 million individuals employed in healthcare with a variety of disciplines and specialties. While sufficient to run statistical analysis, our sample size did not allow us to get into between or within specialty variation. But the good news is that this is an ongoing study. That's where you can come in. If you or someone you know is a physician, a nurse, a biomedical scientist, a researcher, a mental health clinician, or other allied health professional, we want to know about your experience. Click the link here or in the video description to take our short survey. It should take approximately 5 to 10 minutes and can contribute to fully understanding the totality of the impact of COVID-19 on healthcare professionals in this country. As long as healthcare professionals are fighting on the front lines of the coronavirus pandemic, we will be conducting our study to see how our communities can best support these heroes. Thank you for your time.
This video is just a brief summary of a far more extensive and in-depth study conducted by the Cressair Lab. If you have more questions, or if you're just curious to see what the full report looks like, be sure to visit our website. You can find any information you're desiring there, or contact information to reach out and ask any questions you might have. You can find the link below. Additionally, a special thank you to Dr. Girda Nicola, Dr. Sydney Coupé, and Dr. Marie Etienne for all of their tremendous work and outreach for this project. It couldn't have happened without them. And a final thank you to you for watching. Have an awesome day.